I absolutely support universal health insurance. And it's going to be a very difficult concept to get to. But in reality, if we don't get there, what we will find is a lesser system that costs equal or more than the present system. We have to develop a smart delivery system, one. Two, I think to be competitive economically in a global economy, we have to allow our industry and business to be in a competitive role with the rest of the countries. For instance, a perfectly little example, in Canada, when they compete for defense contracts in the United States, which they have a right to do as being an element of NATO, they have an 8% advantage because the government provides health care to Canadian workers, and it's not the role of industry to provide that health care. And as a result, industry can bid 8% less than American companies. That's one of the reasons we lose so much in defense contracts to American providers. They're just at a competitive disadvantage. That can be applied all across the board to the auto industry, to the energy field, anywhere you look, where American, we have really an obsolete delivery system for healthcare. It occurred that way because of historical circumstances, but it's time now that we join the industrial nations of the world, understand what they're doing, develop a system that we can do. And I think ultimately in doing that, we spend more per capita for healthcare than any other nation in the world, and yet 47 million of our people aren't covered. And sometimes the quality of healthcare for a large portion of our citizens aren't adequately covered. I think by looking at it, and government has a role to play. There's several models out there that have government in a greater or lesser role, and I don't really care which one we select, except I think we have to solve the problem. We have to look at it and select the best for the most efficient and effective delivery system, and we can do that.